Sickle cell disease is the most common single gene disorder in the world. It is a serious public health issue in the whole of sub-Saharan Africa. Over 150,000 babies are born with sickle cell disease yearly in Nigeria alone. It is estimated that about 95% of these children die before they reach 5 years of age, some even without their parents knowing they had sickle cell disease. Over 1,000 children are born with the ailment on a monthly basis despite public education. Sickle cell disease is a group of blood disorders typically inherited from a person's parents. The most common type is known as sickle cell anemia. It results in an abnormality in the oxygen-carrying protein hemoglobin found in red blood cells.
Sickle cell is an inherited disorder of the hemoglobin of a patient. The hemoglobin is a molecule actually in the red blood cell of people. Usually, the hemoglobin is actually supposed to carry oxygen to the various parts of the body. Patients with a normal hemoglobin type have red blood cells that are disc-shaped, but patients who have the sickle cell trait have the red blood cell actually sickled, and that is why we call it sickle cell.
Sadly, sickle cell disease is a lifelong illness. The severity of the disease varies widely from person to person. People with sickle cell disease can experience both acute and chronic signs, symptoms, and complications. If a person has sickle cell disease, it is present at birth, but most newborns do not have any problems from the disease until they are about 5 or 6 months old.
So sickle cell trait and sickle cell disease are two different things. A patient with a sickle cell trait means that the patient actually inherited only the hemoglobin S from one of the parents, that is either the mother or the father. To explain this well, when you have a mother who is possibly AS and the father is possibly AS, they can give birth to children who are either AA, AS, or SS. The baby with the AA is not having the sickle cell trait. The baby with the AS has just an S and therefore has the sickle cell trait. The baby with the SS has both the S trait and therefore has the sickle cell disease. So we have so many sickle cell diseases. We have hemoglobin SS, we have hemoglobin SC, we have S-beta thalassemia, we have S-beta not thalassemia, that's beta zero thalassemia. We have so many others. But for a patient with a sickle cell trait, that means the patient just has the S being part of his hemoglobin type. And so the patient can be AS, the patient can be SF, and that is when we say the patient possibly has the sickle cell trait.
The signs and symptoms of sickle cell disease will vary from person to person and can change over time. Most of the signs and symptoms of sickle cell disease are related to complications of the disease: a yellowish color of the skin, known as jaundice, fatigue, and painful swelling of the hands and feet. Let's take a look at sickle cell in pregnant women and athletes. Pregnant women with sickle cell trait may not have any complications, but the baby may be affected if the father also carries the trait. If you have sickle cell trait, experts advise that you and your partner should be tested before you get pregnant.
When we want to go into the types of genotypes, we would like to say that there are so many types of hemoglobin in the world. We have hemoglobin A, we have S, we have F, we have C, we have M, we have N, we have so many, we have D. But for our part of the world, we usually come across hemoglobin A, S, F, C, and D in the labs. When it comes to compatibility, we usually advise that if you are a patient or a person having the sickle cell trait, try as much as possible to actually get married to a person without the sickle cell trait.
Early and regular prenatal care is important if you're pregnant and have sickle cell disease. Having prenatal visits more often allows your healthcare provider to keep a close watch on the disease and on the health of the developing baby. While most people with sickle cell trait participate in sports without problems, there have been occasional serious complications and even deaths associated with dehydration, overheating, and other avoidable situations. People with sickle cell traits can safely participate in all sports provided they take few general precautions, such as drinking enough water, taking breaks when needed, and not overdoing it, especially when starting a new exercise program. If you or your child have sickle cell disease, you should learn as much as you can about the disease. It is important that you receive follow-up care and know the warning signs and complications, so you know when to get medical help. Your doctor will monitor your condition and may recommend adapting healthy lifestyle changes and taking steps to prevent and control complications of sickle cell disease.
So when you get married to a person with AS2, there's the likelihood of you giving birth to a patient or a baby with the hemoglobin SS. And that usually results in complications during childbirth and even the baby. But when you are having AS and the other partner is also having hemoglobin AA, there is much likelihood of you giving birth to an AA and an AS. Usually patients with AS or babies or even kids or adults with AS do not experience much frequent complications and they are able to live a normal life.
Learn the warning signs of serious complications and have a plan. A child cannot be born with sickle cell disease unless each parent carries at least one copy of the gene that causes sickle cell disease.
In Ghana, I think the last time we spoke about an issue where a patient actually went to test. The patient was told that the person was having no sickle cell genes or sickle cell traits and got married and they gave birth to a baby with sickle cell. Usually, there are two instances where this would occur. The doctors may either not explain the results to them well, which we hope they will, or the laboratory person may not hand out results accurately. We would like to say that this is a particular test that is very critical and very important in the lives of people trying to get married. We at Sickle Life are very lucky to actually have one company that is giving us rapid test kits to actually test for our members, and that test kit is the Genotype SC. Well, when we actually test our members too, we tell them to also go for secondary tests when they visit the hospitals. But as part of our advocacy group, we make sure that we incorporate the knowledge about sickle cell disease and sickle cell traits. As part of our mentorship program, we realize that so many people living in Ghana are not aware about sickle cell disease or sickle cell traits. You speak to a person and they haven't checked their sickle cell traits. We would like to say that this is very important, and that is why Sickle Life, we make sure that anybody we come across, we speak to them about sickle cell disease and sickle cell traits.
So it may seem that if you know you have a copy of the gene, the best way to ensure you don't give birth to a child with sickle cell disease is to only have children with someone who does not carry a copy. It would mean exercising restraint on expressing love to a member of the opposite sex before marriage, until you know he or she is not carrying a copy of the sickle cell gene.
Finally, I would like to say that getting to know your sickle cell status is very, very crucial. It is very essential. We are living in a world right now where we are looking forward to a sickle cell disease-free future. We would want to prevent mortalities associated with sickle cell. And before that can happen, you would really need to check for your sickling status. And I would like to advise the youth and even the young ones, and possibly even those who are trying to also get married, that get to know your sickling status. That would help prevent so many problems and so many complications in future.
A comprehensive sickle cell control program should, among other features, include a plan to advocate screening as well as provide education and counseling components to empower citizens to make informed, value-based decisions regarding his or her own reproductive choices. This has been HealthAfrik on AAE TV. My name is Bridget Amadente. Do stay tuned for other programs.